Thank you, Joey. New tonight, Fox 13 is giving you a first-hand look at the grim reality inside our hospitals as the pandemic rages on for almost a year. Our crew toured Methodist University's hospital COVID-19 wing, now dealing with the second surge.
Fox 13's Kirsten Garris is live there at Methodist University Hospital tonight. Kirsten, I cannot imagine for a moment how difficult this was for you, let alone those patients. I mean, the doctors, the nurses, the healthcare technicians. It's just an incredibly difficult time for everyone. What did you see?
Yeah, I mean, this was a very emotionally draining experience for me. I've never seen anything like this in my entire career, and I've been a journalist for almost 10 years now. As you can imagine, for our safety, we were covered from head to toe in personal protective equipment. We had on not one, but two medical grade masks, and our tour was limited to 30 minutes only. But in that 30 minutes, that was just a snapshot, just a snippet of what the 12+ hour shifts our nurses and doctors go through every single day. And I can tell you, based on what I saw on that COVID-19 wing, that is the last place you want to be. Behind two sets of sealed double doors is the COVID-19 unit at Methodist University Hospital.
All the way down to the open door at the end is all of our ICU patients.
It's in the middle of December when we visit.
All right, I don't know how much ventilator support. We're still on 10 a peak.
It isn't as chaotic as you would imagine. It's quiet, it's calm, it's eerie. There's a stillness in the hallways, the quiet hum of filtration machines, the subtle sound of monitors beeping, with hints of flashing lights in every room. As we walk through the unit, we see several patients on ventilators, and if they don't need help breathing, they are still very weak, and you can see the exhaustion on their faces. The reality of the second surge, pounding Shelby County.
That number keeps growing daily. The number leaving and the number coming in are off now, so there's more coming in than there are going out.
Matthew Robinson is the COVID-19 patient care coordinator. It's a role he volunteered for when the pandemic started last March. Now he knows just about everything about every patient on this floor.
We're almost at the point where this is the maximum amount of oxygen that we can give before placing somebody on a ventilator.
This area of the hospital was initially dedicated to specialized services, but once cases started coming here, they decided to turn this into the full COVID-19 wing, many of these patients here needing those critical ICU services. ICU services that are available in all 48 rooms, a valuable setup whenever things take a turn for the worst.
Having the capability for every room in this unit to be ICU gives us that flexibility that if we do need to intubate somebody, if we do need to escalate care, place them on a ventilator, place lines, do dialysis, we can in every room.
Robinson says they anticipated the Thanksgiving surge and prepared for it.
What happens when we run out of space in this area, okay, or plans to go upstairs? What happens when there's more patients than nurses? So then we started to plan our surge plans. So we prepared very heavily, and now we're starting to see that number.
But now he says space is getting harder to find.
This is our one open bed on this unit. We always leave one open for emergencies, and you're standing in the last bed on this unit that does not have a patient in it.
There are 5 adult hospitals within the Methodist healthcare system. Methodist University Hospital President Roland Cruikshank says they're constantly updating surge plans, tracking hospital volume every hour, along with seasonal patterns.
We can look at the bed capacity as a healthcare system. We can look at our entire portfolio of beds and make decisions in terms of who has the most beds, where are staffing, so we can always focus on getting the patient to a bed in the system.
Back in the COVID-19 unit, it's very isolated. Nurses and doctors try to set up routines like daily Zoom calls for loved ones. But nurse Nathan Miller says, unfortunately, some family members are together as patients fighting this relentless virus.
Whichever one is on less oxygen, you try to take them to the other loved one's room to visit. But it's sometimes kind of sad if one family member gets to leave and the other one just can't. And yeah, it's tough having, and you can kind of picture it being your family. And it would be really hard for me.
It's a heartache that is felt on this floor way too often. With hundreds of patients who have come into this unit, Robinson says it's difficult to put a number on the ones who haven't made it out.
You do get emotionally attached, and it's very difficult when you do get to know them and they progress and degress to the point to where they end up passing on. It hurts. You feel lost the same way that if it was somebody that you knew really well, even though we only knew them for a short period of time.
But every day is not a bad one. Patients recover and go home, leading to celebrations that are often as isolated as this unit, but exactly what these healthcare workers need to keep pushing forward.
It's very lucky to get out of here, to leave this unit coming in, whether you had mild, moderate to severe illness, anybody that is allowed to leave here on their own being is very lucky. And it is a time to celebrate.
And most days that COVID-19 wing is hitting capacity, but hospital staff say they have the ability to add 30 more COVID beds and a separate floor of the hospital from the one you just saw in that story. For privacy reasons, we did not record the faces of the patients in that wing, but I saw them. I saw them for myself, and most of them look like me, not in age, but in race. They're elderly African Americans who are someone's grandmother, someone's husband, someone's wife, someone's brother, someone's sister, someone's someone. And they're in there fighting for their lives in that hospital. Reporting live in the medical district tonight, Kirsten Garris, Fox 13 News.
Kirsten, thank you. I know that feeling all too well. I've got a brother-in-law who just went on a ventilator about 2 hours ago. You're watching Fox 13 News at 9. We'll be right back.